Hi, Mr. Smith. My name is Bree. I'm going to be your student nurse today. So far, I have washed my hands and cleaned off my table and gathered the equipment for the procedures I'm going to be doing today. First, is it okay if I go ahead and scan your ID band just to verify who you are? Okay, thank you. Beep. Can you verify your first and last name for me?
I guess I could have asked her on page.
And your date of birth? Okay, great, thank you. So today, just so you know, we're going to be cleaning your wound, applying a new wound dressing, irrigating the wound, and taking a culture of your wound. Are you experiencing any pain? No? Okay. I waited about an hour after you received your pain medication because these things could be a little bit painful. So now I'm going to go ahead and put my gloves on and we can start changing your dressing. And since this is a clean procedure, I can just use normal gloves instead of sterile gloves. Alrighty, Mr. Smith, so let's go ahead and take a look at your wound. I'm only going to expose what has to be exposed for these purposes. Okay, and it looks like your dressing is coming off, so it's a perfect time to change it. I'm going to take it off very gently, starting from one area and moving all the way around. Okay. Alrighty. And I'm gonna look at the gauze that I just took off to check and see if there's any abnormal secretions that were released from the wound as of like discharge or anything like that. And you want to make sure to note that in the patient's chart. And I'll go ahead and take off my gloves and perform hand hygiene. Okay. Now I'm going to inspect the wound for the size, appearance, drainage, and measure the wound. To measure today, I have I'm going to use a cotton swab to measure the depth. Alright, so that's about 2 centimeters deep. And dispose of that in the appropriate bin. And then I can measure. Alright, that's about 10 centimeters long and about 2 centimeters wide. Okay, and for these purposes I had to use the packaging, but in the real setting I would be using a tape measure. So now I'm going to be setting up the sterile field for this procedure, the sterile procedure. Okay, so first I'm going to do, like I said, my sterile field. So I'll grab it by the corners, shake it away from me, make sure it's above my waist. Alright, and then I'm going to go ahead and get out all the supplies that I'm going to be needing for this procedure. So I have my sterile gloves. I have my culture stick that I'm going to be using to collect the culture. My patient's new dressing. And an abdominal pad. And something to clean the wound as well. And I'll apply the medication on the tray just so it's an easy access for me to reach whenever I get to that step. First I'm going to put on my sterile gloves. I have my sterile gloves on now, and now I'm going to start irrigating your wound. So I'm going to be using the vial. For our purposes, I already have it filled up, and I'm going to start irrigating it now. And I would usually also have a basin, so I will use this just to show that whatever I'm draining off would normally go into the basin. And you're draining it from top to bottom to make sure the bacteria does not go back into it. So just like so. Okay, and I'm going to dispose of this in the sharps box. And my medicine is still on there. Okay, and now I'm going to be cleaning the wound out. So here I go. I will grab a Q-tip, and I don't want to be pressing too hard. And you want to make sure to use multiple Q-tips or gauze, whatever you're cleaning with, just so you don't contaminate the surface. And then you'll go ahead and dispose of those. Alright, and now I'm going to be getting a culture of your wound. Before I do that, I'm going to put on some new sterile gloves. Here I am with my new sterile gloves, and now I'm going to take that culture. Okay, I'm going to be taking the culture now. Alright, sorry Mr. Smith, this might be a little painful, but I'm going to go ahead and collect as much as liquid as I can. So I'm going to be pressing just a little bit so we can see what bacteria is in there and get you the right antibiotics. Okay, and you want to make sure when you're putting the cap on to place it in without the tip touching any of the culture on the outside, because this has to be sent off to the lab. And I would normally be putting a label on here with the patient's information on there. Okay, now I'm going to be applying the medication to my patient's wound. I'll be using this cotton swab with the medication that I had put on the corner of the tray. Okay. And now we have all the medication on there. I'm going to dispose of this. And now I'm going to put the new dressing on Mr. Smith. These are going to be his abdominal pads that I will place on him. Just like so. Okay. And then I'm going to window tape this onto him. I'm not actually going to do it, but you would do it like that. And then you want to make sure to go ahead and label what time you placed it on him and the date and your signature. Okay. Just so the next person that changes it know the last time it was changed. Alright, Mr. Smith, I got your wound all taken care of. Now I'm taking my gloves off. And disposing of them. I'm going to perform hand hygiene. I'm going to wash my hands. And then I'm going to close him back up. Put his clothes back on for him. Alright, Mr. Smith, your dressing has been changed. Your wound has been irrigated and checked for appearance. And also we got a culture of your wound as well. Is there anything else I can do for you? No? Okay. Alright. Thank you. I'm going to go ahead and clean up. And I'll check back with you in about an hour, okay?